Hi, I'm Heather Merriman and welcome to Ninja Retirement Solutions. Today I have a little mini Medicare nugget for you, and this is in regards to people who may be eligible for both Medicare and Medicaid. This is called dual eligibility, and it varies by state. This is a great example as to why there's not one perfect solution for everybody out there. Some people are best served with original Medicare and Medigap. Some are better served with Advantage, and that also incorporates into Medicaid. I bring to you today an example of a gentleman that I was recently working with who currently resides in Colorado, where he does qualify for Medicaid. Now, why is this important? Well, the Medicaid aspect of his coverage is going to pay for his Part B. Now, we are currently in 2025, early 2025, and I want you to note that for reference because that very well could come into play in the near future. So again, as of the time of this recording, it is early February 2025, and in his current home state of Colorado, he qualifies for Medicaid because he meets the income eligibility factors, and Colorado has chosen to expand Medicaid. Now, what does that mean in layman's terms? Well, not all states have expanded Medicaid. In fact, only a few have. And what that means is in the states that have not expanded Medicaid, in addition to being low income, for you to qualify for Medicaid, you have to be blind, pregnant, disabled, or caring for minor children. So in the case of my senior citizen in Colorado, since his state did expand Medicaid in Colorado as of February 2025, again, he does qualify still for Medicaid, even though he's obviously not pregnant. He does have significant chronic decisions, but he would not qualify in states that would not or have not expanded Medicaid. Now, as I mentioned, the one thing that means is Medicaid would pay for his Part B, again, $185 a month as of this point in time. It will also pay for his prescription drug coverage. This is significant if you are low income and, God forbid, have serious or multiple chronic medical conditions. So this is huge for this gentleman. Now, because of that, we are also going to take advantage of his one-time chance, because this gentleman is just turning 65. You only turn 65 once, and you are only given one opportunity to enroll into original Medicare with Medigap one time, and that's when you first turn 65. After that, you can apply to various insurance companies to try to get Medigap supplemental, like a Plan G. However, you must be able to get through the medical underwriting for them to approve you onto coverage. And my particular guy that I'm using as an example today would not get through any company's medical underwriting because of his chronic conditions. Now, when you do opt into Medigap, that is going to fill your 80-20 gap. Now, with just Part A and Part B of Medicare, that gives you what is called 80-20 coverage, meaning Medicare is going to pay 80%, you're going to pay 20%. 20% can be a heck of a lot of money. I mean, if we're talking in small numbers to keep things simple with easy math, let's say you were having a $100,000 procedure. Your cost is going to be $20K. Now, if we're talking about someone who has significant medical or multiple chronic conditions, think about how far, the sky's the limit as to what your 20% could be, because there's no max for you. The sky is literally the limit. Now, for this guy, if we opt in with a Plan G, then that Plan G is going to cover 100% of his 20%, meaning that his Medicaid is going to pay for his Part B, that $185. If we get him a Plan G, now Plan G is not free for anybody, and unfortunately it goes up every single year. But in this gentleman's case, it's going to be about $130 a month for him to utilize Plan G. Now, what that will do for him is it allows him to go to any doctor in the entire country that accepts Medicare. Pretty much everybody accepts Medicare if they're an actual licensed doctor in the United States. So for him, with having so many chronic conditions and so many doctors, this is a significant benefit to him to utilize Plan G and have all of his costs. The only thing that he's going to have as a medical expense is $130 a month, okay? Now, here's where his particular example is going to get dicey, and it's going to shed some light on how different states operate. This gentleman's family has informed me that in 2026, the current plan is to move him from Colorado to Florida. Now, what does that mean? Turns out it means a lot in this particular case. So I go back to Colorado and their Medicaid rules and regulations, and they have expanded Medicaid so he doesn't also have to be blind, pregnant, or disabled. Florida has not. In Florida, you do indeed have to be, in addition to low income, you also have to be blind, pregnant, disabled, or caring for minor children. This gentleman does not apply to any of those situations. So if and when he ends up moving to Florida, he will no longer qualify for Medicaid, which means he loses his dual eligibility status and now has to rely on Medicare alone. Now, mind you, this means that Medicaid is no longer paying his Part B. We don't know what Part B will be next year because, again, that also goes up every single year. We know for 2025 it's $185. So next year it's probably going to be close to $200, if not $200 or a little bit more than $200. So if and when he moves to Florida, he's not going to qualify for Medicaid. He's not going to have Medicaid paying his Part B, which means his costs are going to go from $130 to over $185 a month. And now Medicaid is also not going to pay his prescriptions. So we're going to have to look into Medicare extra help for his prescriptions. And furthermore, he's probably not going to be able to afford Plan G on top of his 185 plus Part B. So now we're going to have to switch gears and probably move to an Advantage plan. Now for him, the way the Advantage plan is going to work is instead of his 20% being covered in full, an Advantage plan in most cases are going to be free, meaning again, he's still now only paying his Part B. But instead of it paying all of his 20%, it's going to give him a max out of pocket. This year for 2025, a low average price across the country, I would say, is about $3,900 for a max out of pocket. Meaning when he goes to Florida, he will lose Medicaid. He's going to have to pay his Part B. We will apply for prescription assistance through the Medicare Extra Help Prescription Plan, and we'll probably have to move him to Advantage to be able to give him a ceiling for his out-of-pocket expenses. Now, if we go that route, the downside is we are never going to be able to get him back onto original Medicare with a Medigap plan because of his pre-existing conditions. There are a lot of moving parts in Medicare, and every single year, some of the rules change, and every single year, things for yourself also change, whether it's your health, your finances, your situation, or even your demographics. This is why it pays to have your own dedicated Medicare agent looking out for you, having your back, and putting you in the best position possible for your coverage. And the best part of a Medicare agent? It's free to you. Other people pay us to help you. So please reach out, because we feel here at Ninja Retirement Solutions that you deserve a future masterfully planned.